My name is Madeline Fellin. I'm a veterinarian over in Butte. I grew up locally here in Gallatin Gateway, and my husband Wade and I have a fly fishing lodge over in Wise River that we operate in the summer months. So we're pretty outdoorsy, hunt in the fall, lots of fishing in the summertime, and then I practice year-round working on dogs and cats at Amherst Animal Hospital in Butte. I studied undergrad at Oklahoma State and then got my veterinary degree in Washington. So it's great to be back home. So today I'm going to talk to you guys about first aid in the field. How many of you carry a first aid kit every single time with you? Quite a few. That's pretty good. How many of you feel comfortable using it? Most people, about half of us. So I'd say that's a big part of first aid is we all can carry one, but whether or not we feel comfortable using it is another thing. And so kind of talk about it at the end, but one of the big points that I like to stress is the preparedness side of things. So if we get started, there's also a book I'm going to show you guys. It's great to carry. Dr. Aker is a veterinarian that wrote this book. He was over in Idaho. I'm not sure if he's still practicing over there, but he has a little spot in the beginning of the book just as a reminder that first aid is a wonderful tool to have, but it should never be a replacement for veterinary care. So this is just something that you're going to use until you can get your dog to a vet and see if anything else needs to be done. So a little bit about what we'll talk about. A lot of what I'm going to focus on is bleeding, wounds, porcupine quills, eye injuries, a lot of the things that I see dogs come in for here. Of course, there are so many other things that can happen in the field, but it would take a very long time to cover all those. So in this hour, we're going to mainly talk about wounds and what you can do. I also want to try to help you feel more comfortable about what type of injuries you need to seek immediate veterinary care for, and those that, maybe we have 24 hours or we have a little bit of time that we can get back to the truck, maybe overnight, and then get to a veterinarian, because a lot of our hunting trips, even our fishing trips, even just hiking, backpacking, we're not going to be near a veterinarian, especially in Montana. Sometimes that's going to be a several-hour drive for you. And the bandaging part of it, I'll talk a lot about bandaging, and then I will cover that at the end. I had done a video a little while ago, and so we'll show that. It's about 5 minutes, just kind of the basics of a bandage that you can put on in the field until you can get to your vet. And so starting with bleeding, we're going to have bleeding in quite a few of our wounds, and I think this is something that always makes people panic. Bleeding is kind of scary, especially if you can't get it to stop immediately. But looking at our wounds, we're going to have some superficial wounds, we're going to have puncture wounds, deep lacerations. The first thing I want you to do is stop and try to control the bleeding, and that's going to be using constant firm pressure applied to the area of bleeding. I even tell people stop and set a timer, because really to get some significant bleeding to stop, it's going to take 5 to 10 minutes. But if you're panicking, you're probably going to hold pressure for about 30 seconds and then, oh my gosh, I won't stop bleeding. And so a lot of calls that we get at the clinic are, I need to come in on emergency, my dog's bleeding out, the wound won't stop bleeding, and by the time they get there 10 minutes later, it's stopped. And so you're not going to have the ability to go in on emergency that quick if you're out hunting. And so something you can do, stop and apply pressure. If it's bleeding through the gauze or bleeding through the cloth, and it really will not stop after your 10 minutes, then yes, you probably have more of a serious injury, you potentially have artery involvement, and you do need to get to a veterinarian as quick as possible. Something you can do is apply a tourniquet. And so that will be, you can use, if you have some sort of cloth, something that we keep in our first aid kit is a buff, or often people are wearing them. That can, you can use that as a tourniquet on your way. You're going to place that between the heart and the wound, and then tie it off for about 10 to 15 minutes. You do need to, on your way to the vet, release that for about 3 to 5 seconds at a time to allow what's called reperfusion. If we just cut off all blood supply on that hour drive, we're going to create more problems. So do stop. Hopefully you have somebody with you that can help you, and allow a little bit of reperfusion every 10 to 15 minutes. That's going to be, again, if you have an artery involved. I will say that's not as common as people usually think. I mean, I've treated dogs for very serious dog bite wounds, being run over by a truck. I've treated a dog that was thrown through the windshield in a car wreck, and those dogs didn't have artery involvement, thankfully, and those are pretty serious injuries. So it's not as common as you think, but do watch for it. Next type of wound, these are going to be our superficial wounds and abrasions. These are things likely won't need immediate care. You might not even need care at all. These are going to be wounds that don't puncture the skin. So you can usually treat these in the field, clean the wound with saline, blot it dry, and then apply like a triple antibiotic ointment. If you have one from your vet, or maybe you just have a little bit of Neosporin, usually that's going to be sufficient for these wounds as long as they don't break the skin. And then where you will run into problems with these wounds are going to be if your dog continuously licks this area, they can create a secondary infection. So something else to keep with you, no, it's probably not going to fit in your first aid kit, but maybe in your truck, is to keep a cone. Dogs love to lick at night. Oops, I think I lost my mic. We'll keep going. Maybe somebody will come fix it. Again, dogs love to lick their wounds, and so that's when we can have problems start. So keep a cone in your truck. So this is a wound that probably don't need veterinary care. You can treat yourself. Puncture wounds. This is an example of a puncture wound. This dog, this is just a picture from the internet, but they already have a staple in it. So either somebody tried to staple it or the staples have come out. But problem with puncture wounds is they often extend a lot deeper and wider than you can see on the surface. So this wound really doesn't look that bad, but there's probably a lot more damage underneath. These wounds are from maybe a stick, could be a thorn, other sharp objects. We commonly see them from dog fights. So if you're hunting with a friend, maybe their dogs are, okay, so our puncture wounds, again, they often extend deeper than they look. So what you want to do for this is, again, stop bleeding, how we just learned, and then clean it with saline, blot it dry. If you're somewhere that's really dirty, very muddy, maybe cover it, but then this is something that you want to seek care for in about 24 hours. Usually these wounds do need antibiotics, so that's why you should seek care within that 24-hour time frame. And then sometimes these wounds even need surgery, maybe a drain placement. Again, that's what will be looked at to see how far underneath the surface it extends. This is another type of puncture wound. This is actually my own dog. One of our labs, this whole nother lesson, but to never throw sticks for your dog, and I'm embarrassed to say I did, and that's what happened. The reason you don't want to throw sticks is this stick went end over end when I threw it, and Hopkin dove on it and caused a puncture wound to the back of his mouth. When I ran up to him, it was stuck and he was bleeding a lot. Quite scary, as we talked about. So not to throw sticks. This wound required surgery, but sometimes it's easy if you're out on a hike and you want to play fetch. You just walked by a river. You might pick up a stick, but I would really encourage you not to do that. Fish hooks. So there are two types of injuries from fish hooks. Hopefully, I know this is a hunting group, but I'm assuming some of you also fish as well. Fish hooks can be in the skin or swallowed. So those are our two types of injuries we get from them. If this is something that is pretty superficial, it might be something that you can get out in the field. What you want to do is first start by cutting the line as short as possible so your dog doesn't step on the line, you don't get it tangled in the bush as they're running around and they pull the hook deeper. And then you want to try to advance the end of the hook through the skin. Again, this is only if it's very superficial. Cut that barbed hook if you haven't already, and then back the rest of the hook through the original entry point, and that'll be how to get it out. As Pete mentioned in his presentation, your safety is just as important as your dog's, and so anytime we have these injuries that we're talking about, pain is involved, and even if you have a dog that doesn't normally bite, dog that's not aggressive, they're going through pain and they're fearful because of what just happened, so there's sometimes a tendency to bite. Depending on where the hook ended up, Another thing that we have in our first aid kit is a muzzle. That's just for your safety and your dog's too. So again, just a reminder to watch for your safety. The problem with hooks in the skin, if they're deeper, that is something that will require sedation, probably even general anesthesia to get out. So this is one that you need to take your dog into a vet to be removed. Probably that's more of what you're going to encounter, but this is, again, here's an example of maybe not something that you need to rush right in, but within those 24 hours, do try to find a veterinarian because that's going to be painful the longer that sits in there, more of a chance for infection as well. So fish hooks that are swallowed, this is something that needs immediate veterinary care. This is an x-ray of a dog that swallowed a hook. If the line is still on the hook, never pull on it. We don't want to cause that hook to go deeper into the tissue, but do try to gather the fishing line that it's on and just loosely tie it to the collar so that it is attached and we know where it's at. It's not going to get caught on anything on your way into the vet. If the dog swallows a hook that does not have any line on it, again, try to get to a veterinarian as fast as you can. But if you can't, say you can't get a hold of one, it's after hours, something you can do is feed white bread, or even say you don't have bread, but you just have a bunch of dog food in your truck, is feed some larger meals over the next 12 to 24 hours or until you can get in. Purpose of that is it tries to bulk up around the hook and hopefully help it pass versus their stomach being relatively empty. If you look this up, maybe you've heard stories, you might see all sorts of things to feed your dog. I've heard somebody was recommended to feed cotton balls that had peanut butter on them. I wouldn't recommend that necessarily. I'd be worried about the cotton balls causing a foreign body, but it did work in that instance, and the dog passed, I think it ate 7 hooks, and it passed all of them somehow. But that's a little more serious. So if you find yourself in this situation, take your dog in, get an x-ray, find out where that hook is at, and then probably surgery's next up, or a scope. All right, foot injuries. Lacerations to the foot pads and webbing are pretty common, especially the rough terrain that a lot of our hunting dogs are on. Especially if you're on like a week-long hunting trip, your dog's probably going to come home with sore pads. And so just kind of being cognizant of that and try not to hunt them too hard because those are injuries that are pretty sore and they do take several days for them to feel better from. But in terms of lacerations, common to see them in the foot pads or the webbing. So again, all of our same principles: stop the bleeding, clean it, and then apply a bandage, which, like I said, we'll look at that at the end, and then try to get to a vet so that we can get pain meds, antibiotics, and probably a bigger bandage. How many of you have had problems with these seeds that are up there? Yeah, very, very common. So we see them all the time, come about August when all the grasses are drying and these seeds are starting to fall off. These are those foxtails. They're kind of barbed, and so they're very sharp on the end. They get in there and they're hard to get back out of the skin. We see them a lot with dogs' feet. Sometimes owners don't even know that a grass seed is there, but the dog comes in limping with a swollen foot and a draining tract, and that's usually a grass seed that's caused that. So something you can do is every night after your hike, your hunt, whatever you've just done for the day, is check your dog's feet, especially if you have a dog with long hair. They usually come home full of these grass seeds. Another good place to look is under their ear flaps. That's another common place that they can be stuck. And I've even seen them quite a bit in their mouth. And so if they'll let you, just kind of peek under their gums and look for these grass seeds. Insect bites and stings. Again, this is my own dog. This is Hopkin. This was actually not from a bite. This was from a vaccine reaction, but I use this picture to show you guys kind of what swelling and hives look like on a dog. So insect bites and stings most often are going to cause localized inflammation and swelling. Again, this is probably something you can treat in the field. You want to remove the stinger with some little tweezers or needle nose pliers. Rinse the area with cool water or saline. Some of the first aid kits, whether you buy one over the counter or you can buy your own little ice packs. They're those ice packs that they start to cool once you break them. You can keep those in there and put those on the swelling, and then a little bit of hydrocortisone cream if you have any. Another great thing to have in your kit is Benadryl, just the 25 milligram tablets that people take. The dose is, you can look this up online too, but it's a great one to remember. It's 1 milligram per pound. So for instance, Hopkin, he is 75 pounds, so he's going to take 75 milligrams. Give that by mouth every 12 hours. Sometimes it does make them sleepy. If you give this for a full 48 hours and you don't have any improvement, and we're talking localized swelling right now, then you should take them in and see what's going on. Sometimes those insect bites and stings can get infected. They can develop some what's called cellulitis under them. And so if that's still happening after 48 hours, I'd definitely recommend you take your dog in. Now, the second bullet point, sometimes these bites and stings can cause generalized swelling, so that's what you're looking at here with Hopkin. The most common place it's going to start is on their face and their muzzle. And so you'll see their muzzle swell up, their little eyes kind of start to get shut, and then hives, difficulty breathing, vomiting, diarrhea, weakness. That is something that you need to go to the vet right away because that is something that your dog can die from. Hives on a dog, especially if you have a long-haired dog, can be kind of harder. But if you look closely on this picture of Hopkin, up on his forehead, you can see his hair's kind of spiky. That's where his hives are at. And so you're not going to see red bumps like we see in people unless maybe you have a light-colored dog with really short hair. But in our labs, if you pet them, you're going to feel their skin's pretty bumpy. So 2 different kind of degrees of bites. Torn toenails, this is another common injury that we see in the field, and this is one that can be somewhat easy to prevent by keeping your dog up to date with regular nail trims, whether they'll let you do that at home or if you need to take them into your local clinic to have this done. But keeping their nails short can prevent a lot of this. This is my father-in-law's little German short-hair pointer. His nails got too long in the winter, and then it just completely split in half. This is something that is really painful. It's acutely painful for dog, and then it usually exposes the quick, which maybe if you've trimmed your dog's toenails and you cut them too short and it starts to bleed, that's the quick that's bleeding. That's the center of the nail that has the blood vessels and the nerves. It's a really sensitive part. And if that's exposed, it is really painful. So again, what can you do in the field? Stop your bleeding for torn toenails, you can use, it's called Quick Stop powder. You might see that at your vet clinic or Murdoch's maybe. If you don't have this powder, cornstarch also works in this. And so apply that to the quick that's bleeding, get that to stop, and then rinse it, dry it, and then any of those loose torn toenail pieces, try to cut those off with some nail trimmers so that they don't keep getting caught on things, and then put a bandage until you can get into your vet. This is also another injury that dogs love to lick and cause a secondary infection at their nail bed. And so putting the cone on when you're back at the truck or wherever you're at that you can get to that. Eye injuries are also pretty common. This is something that requires immediate care. One of my dogs growing up got a thorn in its eye, and its eye immediately turned red because that globe filled with blood. So thorns or maybe a scratch when they're running through the brush. If you notice squinting, redness, they're pawing at their face, discharge, elevation of the third eyelid, which is a common question, what is the third eyelid? It's going to be that little eyelid at the bottom that during pain, you'll see it sometimes even come halfway up their eye, and that elevates in response to pain often. And so if you see any of those things, you do want to take your dog in. Try to first flush their eye with some saline and try to remove whatever might be in there. But if the signs of pain continue, do take them in. And then I have another note on here, never use leftover eye medications. Reason being, sometimes, depending on what your dog was prescribed eye meds for in the past, it could have a steroid in there. And if your dog has just scratched its eye on some brush that's been running through and then you put a steroid in there, you're going to cause an ulcer. A lot of the eye medications, The box will have a red or like a pink stripe on it. That's kind of how you can pick out which ones have a steroid in them. But kind of a general rule of thumb, just don't use leftover eye medications until you check. Porcupine quills, this is another really common one. I'm sure, how many of you have had porcupine quills in your dog? Yeah, mostly everyone. So we see it somewhat frequent. What you can do in the field, again, you're gonna have needle nose pliers in your first aid kit. You want to remove them. I guess, let me ask one other question. How many of you were able to remove all of them in the field? About a third of us, 4/4 of us. So depending on the severity of how many quills and where they're at, you might be able to get some of these out. Do remember though, this is very painful. Some dogs will not tolerate having them taken out. The reason it's so painful is if you look at this quill, so that black end is going to be what's stuck in your dog. If you look at that part of the quill under the microscope, it's all barbed, and so it doesn't want to come back out. When you pull them out, it's very painful. So if you're able to take them out, you want to hold as close to the skin as possible. Don't hold up on like that tan part where the quill is going to break, but hold as close to the skin as possible and quickly just pull straight out. Again, if your dog will allow this and it's only a couple of quills, you never want to cut the quills. There's a myth that if you do that, it will deflate them and make them more comfortable, easier to get out. But usually what that does is it just causes problems for us when you bring your dog in, because then the quills are all pretty short and they're harder to get out, or they break when you try to do that. So never cut them. What you can do on the way to the vet, try your best to minimize pawing at the face and rubbing their face. If you have a cone in your truck and a lot of the quills are on your dog's face, try to put the cone on them, because the more they rub and break, then sometimes we can't get them out. So that's what you can do. Here's a couple examples. Again, here's Hopkin making his third appearance. Wade sent me this video or this picture when they were hunting. He had about 10 or 12 quills, and Wade was able to get them out in the field. Hopkins smiled the entire time, but he's a lab, so usually what they do. This is our friend's dog, Gypsy. That was something that we saw at the clinic to get those out. She has them in her leg, her side. And another point about porcupine quills, and kind of what Pete touched on, is it is your responsibility to protect your dog. So no, you can't 100% make sure they're not going to get into a porcupine, but they don't learn when they get into it one time. So I hear people say, oh, they'll learn, next time they won't go after this porcupine. That's not true. So it's your responsibility. If you know an area where there are a lot of porcupines, try to keep your dog away from this area. Try not to let them roam freely at night if you can, because you don't want to end up at the vet at who knows what hour. But here is Gypsy again. I saw her after hours for this. You can see, you probably can't, it's kind of hard because her face is partially black, but on the left picture, her eye, she had a quill that was running from the top eyelid to the bottom one and holding her eye shut. Somehow it did not scratch her eye at all, but she had quite a few in her mouth, and so we had to do general anesthesia on her and pick all of these out. So those ones take a little bit longer and are a little bit harder to get out, so not something in the field in this instance. All right, now, any questions so far? No, and I actually had that on my list. I figured I would be asked about that. So snake bites, if you look it up, you might see, oh, give your dog Benadryl, give your dog steroids. But really what you need to do is get to a vet as fast as you can, because they need anti-venom. So I didn't have it on here just because it's not one that we really can do much about in the field. Yeah, go ahead. Oh, okay. Thank you, Pete. Yes. Sorry, what's the question?
I've heard the vaccine really isn't very effective. Is that true?
I would agree with that. There's not really definitive research on that. Sorry, the question was, is the vaccine for the rattlesnake vaccine effective? When people ask me in the clinic, I say it maybe doesn't hurt, and so we can get it and see if it helps. Some people have said, oh, I had this and it did allow me to get to the clinic. Some people say it doesn't make a difference. So I would say If your dog doesn't generally have vaccine reactions like mine, I would say go ahead and get it because it might help. But it also is going to depend where you get it, because I've also heard that some of the vaccines are more specific to different areas. So if you get a rattlesnake vaccine in Texas, that's probably not going to do anything in Montana. So if you're traveling, just keep that in mind. But yeah, it might help with a little bit of time, but do just try to get there as fast as you can. We're just trying to work on sound, but this is a video of kind of a basic bandage that you can do in the field. This is one of our other dogs, Bodie, our non-accident prone dog. So he was a good demo for this. Go ahead and put a bandage on Bodie's right front foot here. We'll pretend that his wound is right here on this lower aspect of his foot. So assuming that we've stopped the bleeding, the wound is nice and clean and dry, we can now put our bandage on. So we'll start with the non-adherent pad that came in this little packet right here. We'll put this over our pretend wound right here. And next we'll use our cast padding. So we just want to gently, but tight enough that this is going to stay on, but you don't want to be cranking this around. One of the most common mistakes that people do when they put a bandage on is they put it on too tight, and so then it ends up causing swelling of the foot. So just gently roll this around tight enough that it's going to stay up, but not so tight that we're going to cause swelling. We are going to include his little joint right here above the wound. It's going to help his bandage stay up. So we're going to go above what is like his little wrist, go down, include his toes here. And this cast padding, do put a generous amount on, kind of like the name implies. It is padding for the bandage and helps protect whatever wound is sore for them when they might be walking or if they bump into other things. So that's our first step. Next, we're going to cover this cast padding with the gauze. So same thing, just follow where you've already put the cast padding on. Stay. All right, next we are going to put a vet wrap on. This is probably the most common place that people come into trouble with putting it too tight. So vet wrap is pretty stretchy and then it adheres to itself. And so if you're cranking around on that, it's very easy to get it on too tight. The best thing to do is unroll some of it before you begin and then just gently roll it back up so you're not having to pull really hard to unroll it. And then start applying this over his bandage. You want to cover about 50% of the first layer that you put on. So this is the first layer. I'm going to cover about 50% of that with the next layer I go around. And when I run out of the part that I've already kind of pulled out here, just go ahead and pull some more out. Gently roll it back up. And with your vet wrap, you always want to leave a little bit of space from your previous bandages at the top here. So don't have the vet wrap come over the top like this. So the last thing you see is skin and then the vet wrap. You want to see some of your cast padding and gauze sticking out at the top. All right, lastly, we're going to get a little bit of elastic on. This is really stretchy and sticky here, and it works well on the bottom of bandages. So when your dog is walking on it, they don't wear through the material. So we're going to put a nice little bit of it on the bottom here. And then I'm going to grab one more piece for the top. that around the top of his bandage. And then that's it for the bandage itself. We also have this bag in here if Bodhi were in an area where maybe it's raining or the bandage might get wet on the bottom or soiled in some sort of way. You do want to protect the bandage by putting a little plastic boot over it. So we'll put that over it and then use some gauze at the top to tie it so it stays up. And that's it for your bandage. Remember, this is just to get you through until you can get your dog to a veterinarian, but always, you know, apply your first aid knowledge in the field and then take your dog in to see your vet. Okay, so something to note too about that little plastic boot. Yeah, nice video with Pete. Something to note about that plastic boot. One, you can ask your veterinarian. That's just an old IV bag that has some holes cut in the top and then gauze run through it. And also, you never want to leave that plastic boot on. Only leave it on for about 10 minutes while they go out to use the bathroom or whatever they need to do outside. Because if you leave it on, they'll sweat in there and then that bandage will become wet. And if your bandage ever is wet, you need to change it immediately because you can cause a lot of harm to the tissue underneath if you're leaving a wet bandage on. There's one other thing I was going to mention about bandaging. It'll come to me. But that's kind of your basic bandage that you can use. So now, Pete, sorry. Yes, Pete, can I?
You've been to the vet?
Yes.
And the vet says bandage it? Do you have to change it every day?
So the question was, if you've been to the vet and they have bandaged it, do you need to change it every day? Yes. It'll depend what kind of wound you have. If it's a wound, thank you, that it's okay, it has like a lot of discharge, they might tell you to change it every day. If it's kind of a drier wound and the discharge is pretty under control, they might tell you every 2 days, maybe every 3. But usually you don't want to go any longer than that just because, you know, their foot is going to sweat in there and everything. So yeah, probably no longer than every 2 days. All right, any other questions? All right, so now we'll talk about building a first aid kit. And again, those are kind of some basics. There's a lot of other things that we have in our kit and that you might encounter. Pete and I talked about maybe even doing, this is like First Aid 101, maybe doing a second part sometime with some more advanced things that you might come into. But building a first aid kit, what we have is what's called the Yeti loadout box. And so you're probably thinking that's huge. You're not actually going to bring that with you. Let me see if I can move this over too, so everybody can see it. Okay, so that's our first aid kit that we keep in the truck. And so if you want to build a first aid kit at home, that's about the size that you'll need to carry a lot of the things we talked about, and then we'll cover a few other things. But this box is great because it has the divider in it, and then it even has some little like tote baskets, and then a little zipper pouch on the top. And so what we have is our big first aid kit that we keep in the truck, and then a little packable vest or a packable like zipper pouch that you can take in your vest with you. And what you put in there, and I have a video on this too that we can give you the link to about everything that we have in ours, but making a little packable container that you bring in the field with you, and this is going to cover some of your most common things. So maybe you have your needle nose pliers in there, tweezers, you have some eye flush, you have any maybe immediate medications. Again, our accident-prone dog, Hopkin, has a seizure disorder, so we carry some emergency seizure medications with us. But that's just going to be your day pack. And so that can fit in your first aid kit, but then you take it out when you're in the field. This is a pretty kind of lengthy list, but of everything that we've covered so far. So our bandaging supplies, everything we just went through in the video. And I remember what I was going to talk about now for putting the bandage on. We'll borrow, I think it was Fred here. But if you are putting a bandage on your dog, they might not lay there like Sweet Bodhi does. especially if they're hurt. And so if you have a friend with you, the best way to restrain a dog that's comfortable for them and is going to allow you to work on them. So say Fred's left front foot here is what has happened. Gently, while protecting their head, lay your dog on their side and have your friend or whoever is with you, they're going to put one arm over their waist and hold their down foot so that they can't try to continue to get up. And then they're going to gently lay their other arm over his neck, not hard and not causing him problems to breathe, but just very gently, and grab that other foot. So if you're holding like this, and then they can put pressure, and then you can work on this foot right here. That's the easiest way to restrain them. And to get them to lay down in that position, if your dog is standing up and you kind of reach over them and grab their foot that's closest to you, and then have somebody hold their head or you protect their head, but grab these feet that are closest to you and then gently lay them down. That's going to be the easiest way to work on them. So that was what I was thinking about with bandaging. And then for your wound cleaning and disinfecting, saline, dilute betadine solution. If you have a more like concentrated form of betadine, you want to dilute it with water to what's called like a weak tea, so what a very light tea solution would look like before you use it. You don't want to just use straight betadine. Medications, antibiotic ointment that we talked about with the superficial wounds and abrasions, steroid cream that we talked about with bites and stings, pain relief medication. A lot of vets, I know I've had people ask me, not as common, but can I get some medications for my first aid kit? So things we might give you are maybe like a 7-day supply of some pain medications if you're unable to get to a vet, but it's something that you can just handle while you're out. Go ahead and ask, and they'll probably give you stuff. And then consult your veterinarian for appropriate medications. As I mentioned, for Hopkin, we carry emergency seizure medications. And then specialized tools. So these are your tweezers, needle nose pliers, nail trimmers. So if you forget to trim your dog's nails and you just got to the field, you can trim them quickly if they will allow you. And then we have what's called the Felco C7 wire cutters for traps, a little bit different brand than what Pete showed us, but accomplishes the same thing. And then I can get it out here when we're done, but we also have what's called a dog airlift. It's by the brand Phyto Protection, and it's a little airlift that you lay it out on the ground if your dog cannot walk for some reason, and you put all 4 feet through, and it's a little sling that then turns into a backpack. So they're in the sling, you have to get down on the ground, put the straps on. I practiced carrying Bodhi. He's about 75 pounds. Not something I'd want to do for a long time, but I was able to lift him and walk with him. So that's a great item to carry. Emergency items, a rectal thermometer for our signs of heat stress that we talked about with Pete, an emergency blanket, a muzzle for when our dogs are painful. If you don't have a muzzle, you can use a leash. And this book that I put up here shows you how to use a muzzle or make a muzzle with like a leash or something. This is the book I was talking about, is a really great one to carry. It covers a ton of things you're going to see in the field, and it's a nice small size that easily fits in your kit, and it's broken down into easy steps that you can follow. And so basically what you do with that leash, you're gonna run it under your dog's, run it on top of their nose first, go underneath and cross it, and then go up behind their ears, just gently so that you can make a muzzle while you treat them. And then a cone, again, that's not something that really fits in the kit, but have that in your truck. Other useful items, disposable gloves. Really, probably should be wearing gloves anytime you're working on them. Probably a lot of us don't in the field, but to keep yourself safe. Cotton-tipped applicators if you find something in a wound that you can kind of gently get out of there. Sterile eye wash solution, and then this is the book that I feel is really helpful. And then lastly, talking about our preparation and training. As we talked about in the beginning, we all can carry a first aid kit, but if we don't know how to use it, it's not going to do us any good. So familiarize yourself with what is in it. Practice bandaging when you're at home and your dog's not hurt and painful. Carry contact information for your own veterinarian, as well as I always like to tell people, if you know you're going to Dell or somewhere in Montana, look up veterinarians near there, because you might be surprised to find the nearest one is 2 hours away and they're not open on the weekends. So then you're going to have to look for another one. And you probably don't want to be trying to Google this when your dog is hurt or if you don't have cell service. And so make a list of some nearby hospitals. It also just kind of gives you a general idea of, hey, I'm going to be in this area. I know that I'm going to have to travel at least 3 hours for care, and just kind of something good to keep in the back of your mind. Regularly check and replenish your supplies. Replace expired medication. So at the end of each season or beginning of each season, go through it, make sure you have everything, make sure it's organized how you like it, how you can use it, and then customize your kit based on your dog's specific needs. So maybe that's whatever activity you're doing, whatever underlying diseases they have, you might have specialized things in your kit. That is all I have. What questions do you guys have?